So this is your letter. Let's just evaluate your letter. Uh, Dear, okay, Dr. G Star, this is fine. Thoracic surgeon, okay. Smithtown Hospital, this is fine. This is okay. This is also fine. That's okay. I'm writing to discharge 50. See, there is no need to write the age over here. I'm writing to discharge James, who has suspected recurrent. No, it's not suspected, it's confirmed. Okay, who has recurrent lung infections. Your further follow-up care and review on double lung transplant suitability will be appreciated. Okay, so you have to understand that this particular letter is not what you say a simple discharge or a referral letter. You have to write it in a transfer way. Why? Because you have treated the patient for recurrent lung infections and now you want a surgeon to assess the patient for double lung transplant suitability. So it's not a follow-up. Okay, follow-up is a letter in which you are a consultant and you are referring the patient to the GP. That is a follow-up. You cannot expect a follow-up from your fellow consultant. They are not bound to be there to follow things up for you. And in this particular letter, okay, you're expected to write in a transfer way, or you can write in refer plus discharge way. Both are fine. Okay, not the way you have written. So how you would have written this purpose? I'm writing to discharge James, who has treated for recurrent lung infections. Your further assessment and management, including a double lung transplant suitability, would be highly appreciated. So this is how you can write it down, or you can just write, I'm writing to transfer James, okay, who has treated for recurrent lung infections and so on. Okay, so that's the way to go. Okay, then James was sent to me on this date from emergency with severe dyspnea, cough, hypoxia, hemoptysis, fever, headache, and facial pain. There are so many things. You can just simply write two different sentences to complete this down, but this is also okay. On examination, his blood pressure, temperature, and pulse were normal. Just write his vitals were unremarkable, except saturation of 80%. Okay, just write. So his vitals were unremarkable except saturation of 80%. Okay, and respiratory rate of 80 per minute. So you have to write this way. He had erythematous oropharynx and audible wheeze. It's not wheezes. You can't write wheezes over here. It's wheeze. On auscultation, bibasilar crackles were audible. So lower respiratory tract infection or bacterial sinusitis were or was suspected, and supplemental oxygen with ampicillin were given. Okay, so that's the way to go. You can, rather than writing so, you can write therefore. It's much better. Okay, next day just write on subsequent visit, or this is also fine, but subsequent visit or next appointment is a better way. James was stable. Yeah, so you can just write on subsequent visit James was stable and his chest x-ray revealed or showed, okay, his chest x-ray showed pneumonia and pleural effusion, and CT scan revealed chronic sinusitis. He was given erythromycin 500 mg. There is no first or stuff, just azithromycin 500 mg. So you can just write, there is no need to write 500 first then 250. Just write he was commenced on azithromycin and ciprofloxacin. That's it. Do not make things complicated. What I see from your letter is that you are trying to be perfect, and this being perfection, or being, in a situation where you think that you have to write a perfect letter, this is making you this has created a situation for you where you're making a lot of mistakes. So please don't do that. There is no extra burden on you where you have to write, anything. Or then, now let's move forward. James's condition, okay, James's condition is satisfactory. So, and it's not so. You write so many so. This so will cause you very so scores. Don't do that, okay? Today James's condition is satisfactory, and antibiotic course is not stopped. Please, antibiotics course has finished, and he is planned for discharge with advice for airway clearance technique. Okay, physician, not physician. See, it's airway clearing techniques by physiotherapist, improvement in diet and exercise, and exploration with surgeon for double lung transplant suitability. Well, the other way to write this particular thing is that you have tried today. James has showed satisfactory clinical recovery as and his antibiotic course has completed. A discussion regarding decreased time in school and increased hospital visits, along with airway clearance techniques with you know um airway clearance techniques, and a consultation with dietitian. Okay, so this is, the whole discussion has been made with his parents. So this discussion was made with either James or the parents. So you can mention that way. A discussion regarding all this has been discussed or have been discussed with James. Okay, that is the better way to write it down. The way you have written, it's not very appropriate, but it's okay. Okay. James is a high school student with sedentary lifestyle and a high BMI of 28.5. His mother has rhinitis and is hypothyroid. His father died of lung cancer at 54 years of age. James has focal epilepsy and chronic sinus infection. He was diagnosed with cystic fibrosis in 2006 and is on phenytoin, Panadol, Pulmozyme, and Creon. In view of the above, I would be grateful if you could further assess and manage him accordingly if you have any queries. Overall, this is not a very good written letter. Okay, it's fine, but you can definitely improve. You do have this ability to improve. This one, I will give you 290. Okay, but you have to improve a lot. That is the reason I'm giving you less score. Okay, so see you in the next lecture evaluation. Thank you.